We're just waiting a few more moments, and we have quite a few people joining us. Okay, I think we're going to start now. Hello, everyone, and welcome to the Special Education Town Hall with the Vermont Agency of Education. I'm Martha Frank. I'm a family consultant at Vermont Family Network and your host for today. Vermont Family Network has been serving families of children with special health needs and disabilities and professionals who serve them for more than 30 years. We are the federally designated Parent Training Information Center and the Family to Family Health Information Center and the U.S. chapter of both Family Voices and Parent USA. A few housekeeping tips before we begin. Today's meeting is being recorded. Participants are muted. The meeting today was intended to be for parents, guardians, and those in a parenting role. However, we've noticed at looking at today's registration list that parents make at least a third of our very large audience today. We want to make sure that we hear from parents, so we ask only parents to ask their questions using the chat box. Chat is set to host only, which means only the host will hear the questions or see the questions. I will read the questions aloud so everyone can hear them, and then our guests from the Agency of Education can answer. Thank you in advance for your cooperation and understanding. We're pleased to welcome our guests from the Agency of Education. Today we have Jacqui Kelleher, the State Director of Special Education, Chris Kane, Special Education Programs Manager, John Spinney, Post-Secondary Transition Coordinator, Ernie Wheeler, Educational Consultant, Educational Surrogate, and Tracy Harris, Coordinator of Behavioral Supports. Here's our agenda today. Our agenda today is Jacqui Kelleher, the State Director of Special Education, will give us an update on extended school year services and compensatory services. Next, our guests will address questions that were sent to us in advance. As time permits, our guests will answer questions submitted in the And now I'd like to turn this over to Jacqui. Welcome, Jacqui.
Oh, thank you so much. Oh, are we doing a poll first?
Oh, a poll, yes, I'm sorry. Who's in our audience?
Mal Madison.
And we still have a few more minutes. People are voting. Almost done. Okay. So Jacqui, this is your audience. Over to you.
Thank you. Hey, Martha, that was super cool. Nice poll. I'm gonna have to try that for our check-ins. Hello, welcome everyone. This is really an honor to kick off this special ed town hall for families. This is fantastic. I'm Jacqui Kelleher, State Director of Special Education. As many of you know, I also wear the parent hat or helmet, depending on the day, as you all know, of four children with disabilities and disorders. The Parent Training Information Center in the states that I raised my kids were just an integral part to growing and developing as a parent. So when Vermont Family Network reached out and said, you know, can we collaborate more? Can we engage our parents more with information? I was, sign us up, absolutely 100%. Our families are partners, and you're experts on your kids. And this engagement and empowerment of working with VFN and working with your districts, you're a key partner to this process. So thank you for having us. And again, the agenda I was asked to do was to address the May 8th memo that went out around Compat and ESY. And then there was some other follow-up questions, and we're inviting our team. So I'm not in control of Janice behind the scenes who's clicking the button. So I guess I'll say next, Janice. And we can say next. Awesome. So for those of you who are just getting to know the AOE or don't know us that well, you know, here are the folks that are working with you with AOE. These are the people that you might want to reach out to. You know, their specific content areas. If I could just take a moment, I think that if our Tracy, Ernie, John, and Chris, if you could say a quick hello, that would be great.
Sure. I'm Tracy, and I'm happily on the special ed team. I've been there for 7 years, and I am the coordinator for behavioral supports.
Hello, I'm Ernie Wheeler. I work with the Educational Surrogate Program mainly, but I also answer technical assistance questions that come into the office.
Hi folks, John Spinney here. I've been on the special education team at the AOE for 15 years, and I'm happy to be connecting with everybody today.
Hi everybody, this is Chris Kane. I am Special Education Programs Manager at the AOE for a little over 4 years. And my role is around supporting technical assistance to the field, so getting information that people need to know out there.
Awesome. And Alicia, are you there? This was one of our wonderful, one of our partners. If you could introduce yourself, I asked them to unmute you.
Yep, so I'm Alicia Hanrahan. I have worked at the Agency of Ed for almost 21 years. Started off 15 in special ed monitoring, and now I do a lot of work with DCF and mental health and interagency issues.
Great, thank you. Next slide, please. So this is for anybody who is on this call, regardless of your role or your responsibility. When you have technical assistance needs, when you have any specific questions or concerns or successes, this is the primary contact for us to be able to get to one of our staff members. So some of you reach out to us individually, that's fine, but we really wanted to promote this hub that we go to draw from the information that you share with us, so we can get targeted responses and get it also out to the field. So we do ask that you either call us or you email us at this address listed here on this slide. All right, next. We've been working hard to establish our purpose and our vision statement. This will be brief, but it's very important to us because it's what drives our work. So Chris, if you could share with our audience.
As Jackie said, we wanted to make sure to include this just to give everyone sort of an idea of where we're coming from as we're taking a look at questions or answers or sort of how we roll out policies. So I'll start with the Agency of Education purpose statement. And the Agency of Education implements state and federal laws, policies, and regulations to ensure all Vermonters all Vermont learners have equitable access to high-quality learning opportunities. The agency accomplishes this through this mission through the provision of its leadership, support, and oversight of Vermont's public education system. And then further, if we drill down a little bit, our special education team took sort of that purpose statement and went through a significant process to sort of analyze where we fit into that vision or purpose statement, and really developed a vision for our team, making sure to recognize that we work together with educators in the field and parents as a group to ensure that students have the outcomes that they deserve. And so our vision is our team, together with all stakeholders, ensures access, opportunity, and equity by providing solution-based oversight, leadership, and support to build capacity and improve student outcomes.
Thanks, Chris. And we really do believe in that role of stakeholder input. The feedback that you give us from your representative areas is just going to make us stronger and to get you what you need to do your work. Okay, next. So the event had reached out and said initially that parents and families, they wanted an understanding of the memo that was released on May 8th, the initial guidance that came out with respect to compensatory education and ESY. And this document, it consists of the difference between these two services, what each means, some considerations at this time, and just preface this by all thinking that this is all framed within this phase of continuity of learning, which went into place April 13th. This is when all students transitioned into remote learning. So next slide, please. So the first section of this memo is talking about compensatory education, which this has been a remedy where the student has been, I'll be frank, denied FAPE, just flat out denied FAPE, something that's outright denied. And Comp Ed is an offer to make up for, compensatory. So it's determined on a case-by-case basis. And what constituted a free, appropriate public education, a FAPE, during continuity of learning. So that's what's encaptured within this particular memo. And again, it's case by case. It's also a data-based decision. And COVID-19 and the transition to remote learning doesn't automatically equate to a denial of FAPE because the environment and the delivery, it changed for everyone. However, as the memo goes on to say, there could be cases where due to the disability, the student couldn't access the remote learning offered by the district, or there was an interruption in providing IEP services and the IEP was not amended perhaps, or revised to support remote learning. So that, there's other considerations, and AOE guidance was to have the IEP teams decide whether and to what extent Comp Ed should be offered. So when we're making these considerations, we are looking at data, we're looking at progress data. These things need to be reviewed, deficits need to be documented, documentation that there are deficits resulting from a denial of FAPE during a continuity of learning, again, framed and couched within this time period that we're in. And when school resumes normal operations, these are when decisions are likely to be made. Next slide, please. So then we went into, so from Comp Ed, then we went into extended school year services. Most people speak the ESY, speak and understand what that means, but just in case folks didn't, we wanted to explain that this is special ed, special education and related services that are offered beyond the normal school year, which often means summer. This can also occur during breaks. It can occur before school, after school, but oftentimes it's during summer season. And ESY is an extension. It's determined by the IEP team on a case-by-case basis, and it's also a database decision when the team comes together. A team which you as families and parents are an equitable member in making these decisions. But ESY is not about a denial of FAPE. It is an extension. It is about significant regression that has been documented previously when school hasn't been in session, or it's about recoupment at recovery, another word for recoupment. It's about recoupment issues during the previous IEP year. ESY, it's not about learning new skills or catching up, but to provide practice to maintain previously acquired or learned skills. Many decisions about who is eligible for ESY were made prior to the school closure. Many districts are making those earlier. And it's based on looking at that previous regression. If decisions had not been made about eligibility prior to school closure, in this memo, the AOE had recommended making decisions about new ESY services not already included in IEP for when normal school operations resume. Because again, like with the other services, we need credible data to make reliable and valid decisions about what constitutes significant regression and what is considered reasonable time for recoupment or recovery of the lost skill. So hopefully that the memo did a job of teasing those pieces out and explaining what was going on in terms of our considerations for initial guidance in these areas. Next slide, please. So we also had an additional consideration section where, basically what we're saying is the AOE does not anticipate that districts will find a large increased need for ESY eligibility because all students are impacted by the school closure and transition to remote learning. If a district determines that it will offer supplemental instruction to all general ed students, an eligible child with a disability does not have to be eligible for ESY to receive the supplemental instruction. Special ed services supplement and are embedded in general education, including any supplemental education provided as a result of extended school closures. It may not be appropriate, it may not be an appropriate consideration to extend remote learning for all students with disabilities during the summer months as part of ESY, as it would be an extension of supplemental instruction and not in alignment with ESI requirements. And next slide. And then we just cautioned by saying for everyone to keep in mind that recoupment, that recovery, in many cases, it can't be accurately measured during remote learning, and regression analysis based on data obtained since school closure will likely lead to unreliable and invalid decisions. And then further, likely all students, special ed and general ed, will have some degree of regression, for sure. So I want to summarize this memo for you from May 8th. That the Comp Ed ESY memo, it was intended for everyone to stop and think about how we determine Comp Ed services and extended school year services during a global pandemic with which federal and state laws were not designed. And I should have said that at the outset, as we're putting out guidance, we are watching vigilantly for word coming from the Office of Special Ed Programs. That's our federal oversight body. And those things haven't been released. And so it's a difficult balance. And every child has been affected. And our children with disabilities, they're general ed students first. So what we're saying is that Comp Ed services and ESY determinations, these are going to require comprehensive factual analyses and discussions by the IEP team. And so again, credible and reliable data for each student, including all the data from the period of remote learning, needs to be looked at and considered. And it's likely that this data may not be fully available until a period of remote learning has ended and normal school operations have resumed, bearing in mind that normal school operations may continue to be affected by COVID-19 in the fall of 2020. So it was the AOE's recommendation that IEP teams should only make decisions about whether to provide Comp Ed services or new ESY services that were not already included in the IEP after the normal school operations resume. ESY, we're all in this together, trying to make it work. We don't know what it will look like for summer programming at this point. For many children, the continuation of a distance learning plan may or may not be appropriate.
And we have to be really strategic about what our kids need, what is most appropriate for them. And ESY must be provided only if an IEP team determines on an individual basis when developing, revising, or reviewing the IEP that the services are necessary for the provision of FAPE for the child with a disability. So just to summarize this further and get to some of the other questions. We did state for districts to be aware that if a student was previously determined to need ESY services prior to school closure on March 18th, 2020, then the student would continue to need ESY and eligibility should continue without the need to make a new determination of eligibility. And those ESY services must be provided in accordance with each child's IEP that requires ESY services. It must be based on the data of regression and recruitment over previous school breaks. The need for ESY is student specific, so on and so forth. Data on recruitment will likely not be determined until the school transitions away from remote learning and resumes normal school operations. And all students, general ed, special ed, all of our students will experience a regression in lost skills. However, what constitutes significant regression and what is considered a reasonable time for recoupment requires that credible data considered by the IEP team to make that decision. So I know no one wants to make a rash judgment. This is such a challenging time, and there's so many concerns about loss. There's also some great stories about success that's happening as well. But you know, we have to be very careful about coming up with inappropriate programming for kids under the conditions of the pandemic. We also want to ensure kids are getting what they're entitled as a general ed student first, and then enfold them with the layers of special ed and related services and supports that are necessary for them to access the general education. That is what is entitled to all eligible children. So, and that balancing act you're going to be doing as a team in working out what this looks like for a child. We also don't want our kids to be in schools 18 hours a day to make up for services. So that's why I was talking about being strategic about it. It's about being appropriate, but what is reasonable, what makes sense, what's going to be effective. And the family voice is an important instrument in moving forward as these IEP team decisions get made. So, you know, I'll just say again, we appreciate being able to have this frank conversation with you. We are in uncharted territory, uncharted waters, and our hearts are absolutely, you know, from AOE to families and to school districts, our hearts are affected by the challenges families have been facing, the stress folks are under to educate our children and youth. But we need to do this right and well, and we're trying to strike a balance of what our children need amid laws not designed for a global pandemic and the programming that will lead to improved outcomes for all those children with disabilities. So I'm turning to my team members. Do you have anything to add around Comp Ed and ESY, that particular memo? Take a look.
I'm good at this time, Jackie.
Okay, thank you. All right, so next slide. And can we do the next slide again? Sorry, I already went through that. This mouse, my goodness. So here are some VFN submitted questions. And I think the first two were answered, and I'm having my screen has frozen. So, you know, this one, the first two bullets had to do with questions around ESY and our struggling learners, and whether multiple contingencies should be made. And, you know, we're asking at this time that, you know, follow the guidance, you know, outlined in our memo about looking at forthcoming guidance anticipated at any point. If the student meets eligibility for ESY, it's the intention to offer, you know, services that are going to be following the manner of health and safety guidelines with which that allows us to do so. this, don't want to get too far ahead too, but as we're looking at governor orders and whether contingency plans might be a hybrid if possible, if not possible, being able to revisit the distance learning plan, the IEP, and to work with families to figure out different solutions. But all of our guidance is taking into the consideration that that also there could be potential future surges of the virus that may force or lead to a different configuration of school once they've reopened. It's an ever-evolving situation with which we're all learning to be more efficient and effective in multiple ways. But it's about being able to work together in partnerships as IEP team members, grounding ourselves in data, and making decisions in new ways, and being able to have plan A and plan B in our back pockets to be able to address those individualized needs.
Jacqui, this is Martha. Can you hear me?
Yes, I can.
Would it be helpful if I read the questions if it froze on you? Would you prefer me to read them?
Actually, I can turn it over to my team. Ernie was taking the next one, and I can try to unfreeze myself, although it is a little hot.
Freezing's good.
Ernie, would you continue?
Sure. The question is, like many school-based psychologists, I had approximately 25 scheduled evaluations postponed due to COVID-19. Teleevaluation is being used for competency sanity assessments, as well as the examination for DDS individuals pursuing disability benefits. If schools continue to be closed next fall, will remote evaluations be considered an option? Certainly, the National Association of School Psychologists has put out guidance regarding teleevaluations. And basically, it says that where available, online or virtual assessments will be allowed, and companies are trying to develop those assessments at this time. If the student requires an in-person assessment and school is still closed, it must be delayed until the restriction on in-person services is rescinded. Other assessments, such as rating scales and interviews, may also be continue to be done virtually. That's my answer.
Thank you.
So the answer is yes.
And then Ernie and Tracy, this next bullet came in. And again, thank you we did have some families submit some, or this is a combination of some families who've asked these questions. So thank you.
Yeah, in response to what a family should do if they do not agree with the changes that the school has suggested to make during COVID, what should have happened at the start of this period of a continuation of learning should have been that the school, and I've spoken with many of you and with many school officials who have said that they've worked together with you to create a distance learning plan. And usually the school has put together what they have thought would be a reasonable offer, and then discuss that with you to try to ascertain whether it felt reasonable to you. If families were not happy with what the school offered, they should have been offered the opportunity to have a live IEP meeting that would have been conducted virtually, of course. But that's what should have happened, and that's what can continue to happen now. I do know, after speaking with many, many school officials, that the distance learning plans are considered a fluid document. They're ever changing, and oftentimes they're changing to meet the family's need for either more or less services. Some families have felt overwhelmed with how many services are being offered, and so that has changed. We've considered that to be a pause in service, not that you are declining services and would have to then jump through all the hoops to get those services back. It would just be a pause because due to the circumstances of the pandemic, the family is overwhelmed right now. But I'll let Ernie answer from a more strategic lens.
Tracy, you've said everything just about what I was going to say, with the exception that parents, what they should be asking for if they do not agree are things that the school can provide, like an extra session of virtual check-in for their child. What they can't ask for are things that are beyond the school's ability to provide. In-person services at this time are not allowed, and so they can't be asking for those kind of things. But at the end of the IEP meeting that you said they should request, they should be also expecting something in writing from the district to indicate what was the result of that IEP meeting.
And I'll just add in there too, we do have on our website, and we will show you where that website is in just a moment, a memo specific to amendments to the IEP, or when we introduced the distance learning plan. That was March 27th that went up. We also have sample distance learning plans available for you to look at. These are not mandated by the AOE. These are visual models that kind of illustrate what should be considered in a distance learning plan, not only for practices in programming, but also when making considerations for budgetary concerns about meeting the criteria for appropriate federal funding agencies. So thank you. Hey, Tracy, can you take the next one?
Oh, sure. So the question is about families who have children with intense social, emotional, behavioral needs, and wondering if they can get one-on-one support for their child during this period of remote learning. And then there's a second part, which I'll get to later. The answer is yes. To the degree that one-on-one services were written into the student's IEP before COVID happened, then the team should make that happen to the greatest extent possible. Again, we're limited by what we're able to do per the governor's orders and by health and safety regulations. So that support may have to take the form of a variety of creative remote strategies. And I have seen schools being very, very creative here, and I have seen schools partner wonderfully with mental health agencies. And so that gets to the second part of the question, which is, what if the school had previously, before the closure, been contracting with the designated agency of mental health to provide in-person support at school, but now the DA is providing one-on-one support to the student for non-school related activities. In this instance, can the school allow the DA to provide the previously contracted school support in person? So, until just very recently, mental health agencies were under the same restrictions as schools were. Neither of us were able to offer in-service supports until the governor, based on data, based on safe and health regulations, allowed us to do so. Schools are still not allowed to do so, and mental health agencies have been allowed to offer some limited in-person supports only when it's been considered an essential support based on medical safety situations. And those have continued, those have just continued. Crisis lines have been open 24/7 all through the pandemic and school closures. With the recent turn, with the very last turn of the spigot, as our governor states, I believe that he has included some social workers and some private therapists to be included in this next round of people that can offer in-service supports. I know that mental health agencies are ramping up, as are schools, ramping up for when the next turn of the spigot comes, how can we offer more in-person supports? Until we get that green light, we're left with being creative with remote strategies. What I can tell you is that, how do I want to say this? What I can tell you is that schools are passionate about this work. This population of students are the ones that are keeping us awake at night all the time. You have to remember that most of us, teachers and educators, are parents as well, and many of us have students with disabilities. I have 2 students of my own with disabilities, one of them severe social, emotional, behavioral. I think, if anything, the pandemic has given each of us a greater degree of respect in terms of, or appreciation, I should say, in terms of what each of us are dealing with. Anyway, I can tell you that every school official that I've spoken with has these students in mind, because they know that it's being very difficult to meet their needs remotely, and they want to make it better, and they are doing creative things. I can highlight just a few creative things because I don't want to take up all the time here, but I can tell you about creative offerings where a school clinician through the mental health agency has offered a virtual drop-in center through Zoom or Google or whatever platform they're doing at school for virtual drop-in for emotional supports, regularly scheduled Zoom breaks for self-regulation or mindfulness or yoga, behavior interventionists who have been hired by the school through the designated agency have been doing morning and afternoon check-ins over the phone or in Google Chats with students, with families. We have offered special educators ideas for how they can work with families to do PBIS at home, positive behavior interventions and supports at home. We have talked with special educators about parent counseling and training, which is a related service that, that could be provided that would allow parents to better understand the needs of their child and to have greater understanding of the tools and how they can help them meet their IEP goals. Those are just some examples of how we've gotten creative in meeting the needs of these kids. I've asked Janet to drop one guidance document into the chat, and there are others in the work as well. I guess all I can say is that I know that educators are passionate about meeting the needs of these kids and wanting to make it right for them. And, you know, Jacqui talks a lot about data-based and strategic decision-making. And yes, we use data to make our decisions, but we are passionate about doing what's right for these kids.
Nice. And Tracy's referring to a document she and her team created, responding to challenging behaviors, that came out April 9th. Alicia, we have you on the platform too, as we're talking about mental health. Do you have any comments for family considerations or updates?
Right at the moment, no, I don't have any updates. You know, we're talking a lot about, I've been talking back and forth a lot with mental health and trying to create some resources on social emotional learning that could be available to families as well as students and teachers. So we've been doing a little bit of that. We've also been doing a little bit of that in-house as well. There's kind of a cross-team work group that we have at the office. And, you know, Tracy is definitely accurate. There's some very creative things that schools have been, not schools, that the designated agencies have been doing to make sure that kids are getting the supports and services. It's not working for all kids for sure, but, you know, they're doing the best that they can.
I also wanted to mention that from my perspective, I think that at the state level, the Agency of Education and the Department of Mental Health are working more collaboratively perhaps than ever before. We have been meeting regularly. There was a joint memo from our Secretary of Education and the Commissioner for the Department of Mental Health Services that basically encouraged mental health agencies and schools to maintain their coordination for school-based mental health services. I know that the big question on everyone's mind is what's next? When are we going to open? How are we going to reopen? What's that going to look like? And none of us know exactly yet what that's going to look like, but I can tell you that first and foremost in everyone's mind is how do we meet the social, emotional health, mental health needs of everybody, of teachers, of students, of families, of our communities. We have all, in our own ways, been exposed to this traumatic event, and we are all, schools are recognizing that if anything, they're going to need to increase their partnership with mental health agencies. We don't know how we're going to pay for that, but we know it has to happen.
Thank you, Tracy. I'll
Sure.
turn it over to John Spinney for another question.
Hey folks, so the question that we have now is what should families with students on IEPs who are due to graduate next month do if their student has not been able to benefit from appropriate transition services and supports and has not made sufficient progress due to remote learning? So this one ultimately falls back in the bucket that we were talking about earlier related to identifying what basically once students are back, being able to look at what regression there was and what supports and services were not able to be implemented during this time of remote learning. So that is sort of its own bucket that is related to specifically to transition services. And I just want to remind folks that several years ago, there's an existing resource that is very relevant, even more relevant than maybe it was when we first created it. But several years ago, we had an interagency team that was put together that looked at readiness to graduate. We had VFN there, we had developmental services, we had AOE, we had Voc Rehab, and some other folks as well, other stakeholders as well. And basically that graduation readiness tool is a transition checklist essentially. However, it was designed in a way so that the student themselves can have significant input as well as all the members of the IEP team to essentially try to quantify access to transition services. It's something that we had never attempted to do. It was typically looked at as, okay, well, this student has met the graduation requirements, so they are ready to graduate. And then in other parts of the state, we had schools that had a culture where a lot of students with developmental disabilities just continued until they were 22, and that was just their system. So what we did was that tool is there to help teams quantify and make that decision around appropriate time to graduate. So having said that, if there is a student that is turning 22 during the school year, there is a exception process that special ed directors can apply for, and it's essentially for students that are set to graduate within 3 months of graduation, or if there was significant loss of services during their time. So there is a process. If you have a son or daughter that is going to be turning 22, ask your special educator to reach out to me and I can get the application form. That's an existing exception process that we've had for many years. I think that's all I have on that one for now.
That's right. And so these determinations are made on a case-by-case basis, John, correct?
Exactly.
Right. And I think that we put in the chat your memo on implementing transition services, which came out April 14th. And so
Yes.
John's working on, he has upguiding guidance coming out more around secondary transition, post-secondary transition.
And summary of performance. We have an updated template for the summary of performance, which all students who were on an IEP, this is part of IDEA across, nationwide. Prior to graduation, students need to be issued a summary of performance. It's a summary of their academic and functional achievement. And essentially it's identifying what things worked really well for this student in these different environments, academic as well as a work-based learning environment, as well as what kinds of accommodations were helpful. And it's something that would typically go to a student support office in a college or to an employer or even to a designated agency that is doing supported employment.
John, if you have a new template, could you send it to Vermont Family Network and we'll put it in the chat?
Yeah, it's not live yet.
Okay,
Yep.
Thanks.
Great. Tracy, can you take us on the next
Yes.
question?
So the question is, isn't there a higher or different standard for students on IEPs through the entitlement of FATE versus that which students in regular education have? And if so, shouldn't their needs be considered and addressed differently from their regular education peers when looking at the lack of progress or backsliding that may have taken place for them? So the answer to this question is that every one of our students is going to be assessed for regression of skills. All of our students with disabilities are gen ed students first, and then additionally students with IEPs. So every single Vermont student will be assessed after in-service supports are allowed to occur. And that's because all students experienced a disruption in their education. But absolutely, yes, IEP teams will be conducting these types of determinations, just like Jacqui said in the beginning, and they will be done on a case-by-case basis, again, after in-person supports occur, because that is the only way that we can get credible data about how much regression has occurred. One of the first pieces of guidance that we gave to special educators when we were anticipating school closure was collect your data, gather all your data right now so you know where your students are functioning right now. So we will be conducting calculations based on where students were in March and where they are whenever we get back to in-school supports. And every student is unique and different, and every student will be treated that way. There won't be any one-size-fits-all offerings of Comp Ed or ESY. It will be an assessment based on each individual child's needs.
Great, thank you. And then I think we have one more question. Maybe Ernie, you could address, I think it was virtual evals. Yeah.
And I will also say we have a few questions that have popped in since we've been chatting. So it's 3:45. We can go a little bit over the time, but when Ernie's done, we'll pop a few of these questions out. Thank you.
Okay, the question here is, with the wide variety of evaluations that can and are being done virtually, what can a parent do if the school district says a virtual evaluation is not possible and the evaluation must be delayed? We have some guidance on that in our questions and answers. So I have a link that I can certainly send forward regarding this, but an initial evaluation is supposed to be done within 60 days of receiving parental consent for the evaluation.
Okay.
If this can be done through a record review, that's possible. In addition, it can be delayed if there's an appropriate reason for the delay. But in this case, you're asking if they have the virtual resources to do that. That would be a question that should be discussed at the evaluation planning team as to how those evaluations are going to be conducted and where those evaluations are going to be conducted. Just because there are evaluations out there that can be done virtually doesn't mean the school has access to them or has the professional staff that can provide those assessments. So those are the things that need to be discussed at an evaluation planning team meeting.
Great. Thank you. If we could just get to one more slide so we can close out. We can skip that one. We've already answered it. I want to highlight this bullet that drives everyone crazy, but is the reality, is that guidance may change. We seek to update to the, I'm using our OSIP language about to the greatest extent possible. But we're in that situation of waiting on federal guidance on some of these pieces, but also being very, very aware and sensitive and trying to be responsive to your needs to get information now. We don't want to have that inconsistency. We don't want to have to go and backtrack if we make decisions that aren't in alignment with some of those federal requirements. So as we put out guidance, we appreciate your patience with this. We're trying to do it right and well, but we're also saying in uncharted territory, as I said, things may change. So with that, I think the last slide was just opening it up to conversation.
Thank you, Jackie. So we do have a few questions and we have about 10 minutes left. So I'll read the questions and this one may be fielded to John, but I'll let you all decide. This John may be about the graduation piece again. If a student is due to graduate in June, how does a team gather the data without actually coming back together to collect that data related to regression? Would this be an extension piece?
In terms of transition services, it's a little different than regression because you want to look at what was in the IEP prior to COVID that is not able to be implemented right now. And the IEP team needs to look at that and check it against the checklist to make a decision. What are we going to do? Are we going to have the student graduate or are we going to have the student come back? This is assuming the student is under 22 years old.
I think the question is if the student is 22. I think that is the question. 22 and due to graduate.
So if the student is 22 and set to graduate, they can apply for the exception. Okay. That's a process that we've had in place for many years. Ask the special educator to reach out to me to get the application.
Okay, that's great. That's great. Now bear with me. I'm toggling in here. Let's see.
You're doing great. We still have a lot of people on the line. This is fantastic.
This is great, and we can always get more messages. I just have to read them. Let's see. Will parents be considered, and you can decide who's going to answer this, will parents be considered out of compliance if they decide that the district's remote ESY is not the best option for their child? We can go back to that one too.
Would you mind repeating it?
Yeah.
Sure.
That's interesting. Yeah.
Sure. Will the parents be considered out of compliance if they decide that the district's remote ESY is not the best option for their child? And I'm assuming this is about safety, or maybe it's choice. I don't have any details.
That's hard. And I'm looking to my team too, because there's so many questions about how to unpack that one. Mm-hmm. Is it because they're not agreeing with the services? Is the, what is the nature of the denial? Are they asking for just not right now and pick it up later?
You probably need more information to answer that.
I definitely would, and that's something that please use that AOE email and get us that information, and maybe we can talk through it a little bit to unpack it. I don't want to answer it as is because it's layered.
It's missing a few.
Yeah, that's a good one for the TA line.
Yeah.
Okay. Okay.
I can just offer, though, that if the case is that, well, remote learning hasn't worked for my kids so far, you're just going to give them more remote learning over the summer, that's not going to work. And that's reasonable. So that would be something to unpack.
Okay. Here's another one. What ideas did the Agency of Education have about improving the Family Parent Special Ed Survey that goes out annually for Indicator 8?
Oh, pick me.
Well, that's a good one. me. Go for it, Jacqui.
So we have 17 indicators. For those of you at home who are not familiar with how we're evaluated as a state, indicator number 8 is around parent engagement, and a survey goes out. So as you know, I'm in my first year with this position and now collaborating with my team. We've been using the same survey for quite some time. We have a vendor out of SUNY Potsdam that's been doing the survey. The survey is a national tool, by the way. I'm not putting SUNY under the bus in any way. They're using something that's already been designed and approved, if you will, by OSA. You don't have to use that tool. And I know that that folks that are working on that indicator 8 specifically from the programmatic perspective will be looking at having work groups to unpack that, what's wrong, what we want to change or modify to that tool, and to get it right. But for this year, we have 1 year on that contract with the current vendor, with the current tool. We'll be in conversations this year about how to improve it and how to get your information accurately, really inform the practices that we have at the agency.
Great, thanks. Okay, here comes another one. How do I get a copy of my child's school records as they were used for a record review, but I never received any copies? That might need to be unpacked also, but.
Maybe. I think Ernie has had questions like this before in the past.
I think the answer is in the evaluation report that they get from the school, it should list the things they used as a record review. Then I would be asking for those specific items so that a parent can have the same level of review. And that should happen prior to the decision as to whether the child is eligible or not, so the parent is informed going into that meeting.
Okay, very good, thank you. And this may be our last one. I'll have to just check again in the chat. Can you explain why the education system is having different regulations than the daycare system that has opened up? They are allowing up to 25 kids in a class.
That is an excellent question. In terms of being able to give a thoughtful answer and trying not to have the Jacqui with the parent hat respond versus the agency hat. I don't know if I can answer that with complete accuracy. The difference between the education services and the programming world that we're in compared to what's going on with childcare with essential workers. Although there have been collaborative communications among parties, it's very different from where we sit. So I'm not sure if I can give the straight answer. I don't know, Alicia or anybody else, if you had additional information to share.
Well, I mean, we're subject to Department of Health and the governor's order, so that's been a big part of it as well.
Right.
So
and when they're talking about 25 kids in a daycare, they're not talking about 25 kids in one room. They're talking about a facility that can separate kids out and have a low number of kids, 2 adults, in the classrooms that they have. They're not talking about 25 kids in one room with adults. So it's very much not like a school situation.
Good point.
Good point.
So I think we have 2, and then I think we're going to wrap it up.
Thank you. And I apologize. I do have to go take a federal call in 1 minute, so I do have to hop off. But I really appreciate you inviting us to the conversation. I'm interested if folks want to do this periodically, just let me know. But I gotta talk to OSA.
Okay. We'll wrap up. Other folks are going to stay on for the last 2 questions. Yes. Okay. I'll do one question. Bear with me. Okay. it was really more about extended school year, and I have to go back and find it. And I think the family that wrote in wanted to know if there were other prongs of looking at extended school year. Was it just regression, or is it also about meeting the IEP goals? That would be the last question, and then we'll go to the poll. And anybody can.
Well, I just want to point out something, and then maybe Ernie or Tracy, if you want to chime in. Just remember that, you know, the IEP is written, of course, with all of these goals, and the LEA is doing their best to help that student meet those goals. However, there are times throughout a student's career that they're not going to always meet those goals. However, was the access provided? Was the reasonable and appropriate access provided to that student to be able to meet those goals? It's the access that should be looked at, not necessarily did they meet the goals or not. Was the student provided access? Ernie or Tracy, do you want to, or Alicia?
Well, the rule for ESY talks about regression, but it also talks about meeting appropriate annual goals. So if the annual goal is for the student to meet it over the course of 12 months, that would trigger a recommendation for ESY. If, as John says, with the appropriate resources and access, a child can meet that accomplishment or meet that goal within 10 months, then there's no need or requirement for, you know, an extended school year.
Okay. Thank you very much. Go ahead.
It's about regression and recoupment. So, you know, it's a given that any child may regress some after a break from school, but the question is, are they able to regain those skills after a reasonable amount of time?
Thank you, Tracy. So I think we're going to go to poll number 2, and then we're going to wrap up. So did you learn something new? We'll give you a minute or so to answer these. And for our participants, it's really helpful for us to get feedback. So it'd be really great to hear what your thoughts were for today. Perfect.
Wow, sweet.
That's great. Thank you to all of you, thank you. So I'd like to thank all of our presenters and all of you for joining us today. Let me close the poll. An inspiring keynote presentation is on our agenda for tomorrow. We invite all of you to attend the Virtual Youth Summit with a dynamic speaker, author, and hope dealer, Hassan Davis. If you've never heard Hassan speak before, you don't want to miss it. Details and registration can be found on the homepage of our website, vermontfamilynetwork.org. And there's still plenty of room on the webinar. Please remember that we are here to help. If you can contact us as shown here, you can also get connected by subscribing to our e-news, following us on Facebook, and if you're a parent in a parenting role, join our closed Facebook page. Thanks again. Hope you have a great day. And I want to thank again all of our presenters for taking time on this very warm day to sit and participate in this. It was really a great gift to parents and professionals that decided to participate with us today. So thank you very much, all of you.
Thanks.